Hi, I'm Suzanne and I'm one of the registered nurses here at Pacific Center for Plastic Surgery. I'm going to talk to you today about your post-operative instructions for the LiteLift. We're first going to talk about your activity. When you go home today, you're going to rest. And it's important every couple of hours that you wiggle your toes. You don't need to wake up in the middle of the night and get up and walk around, but we do want you during the daytime hours to get up and move and wiggle your toes and keep that blood circulating. If you have TED hose on, you need to keep those on your feet too for about 14 days after your surgery. Also, it's important to remember that you can't do any heavy lifting or bending. There's no sexual activity for 2 weeks after your procedure, and you also need to not drink alcohol or smoke during the next 2 weeks. Let's talk about position. We talk about sleeping elevated for 2 weeks after surgery. What we're talking about is at least 2 pillows. You don't have to sleep completely straight up, but we do want you to sleep slightly elevated on 2 pillows. It's very comfortable to sleep in a reclining chair or on a big soft couch for the first 24-48 hours. Please remember that when you do sleep elevated, that your head tends to turn to one side or the other. So you can use pillows to place either on the right or the left if you tend to sleep on the side, so that you don't tend to roll over and sleep that way. If you do, you can get a lot more swelling on that particular side of your face. Next, we're going to talk about ice. Ice is a really important part of your recovery process. What we recommend is using frozen peas. You can take the frozen peas and separate them in little baggies so that you can rotate them in the freezer. And what you're going to do for the first 48 hours, because the wrap is on your head, is just use that gently on your face to help cool down some of the swelling. Once the wrap comes off, and we'll talk about that in a few minutes, you're going to use the frozen peas then on the areas where the actual incisions are. If you try to use ice over the wrap, it really doesn't penetrate through that dressing. So be sure to use them just on the areas of the skin exposed. You're going to leave the ice on 20 minutes on, 20 minutes off, because your face can be a little bit numb and we don't want you to cause any frozen damage from having the ice on too long. So be sure to use a timer or make sure someone's helping in case you fall asleep. I don't want that ice on your face for a long period of time. Next, we're going to talk about wound care. There's really nothing that you're going to do for the first 48 hours because your wounds are all covered up with a wrap on your head. If you have a blue peel, then you're going to just gently wash your face, which most of our patients tend to do the blue peel. So you're just going to gently wash your face with a gentle soap and cleanser. And other than that, you're just going to do some pain control, sleep elevated, and walk around. After that 48-hour period, then you're going to remove the wrap, and then you're going to take a shower, and then you're going to clean the incisions with peroxide and water, half and half, and then put a thin layer of bacitracin. It's really important by the 3rd day that those incisions are clean and scab free. We need those scabs gone because those scabs contribute to having scarring, and we don't want any scarring in our post procedure healing time. If you have any questions about the scabs, or if the scabs aren't gently working themselves off, please call our office and talk to the nurse about this. We don't want you picking your scabs or trying to break them off, because they will gently work off with the peroxide and the bacitracin on their own. Diet is another important part of your recovery process. The first couple of days, you might want to stick to a soft diet, which could be protein shakes and scrambled eggs. As you can tolerate regular food, you can go on and start eating what you normally eat in your diet. During your post-operative time, you're going to be taking pain medication. We don't want you driving while you're taking any pain medication, because this does inhibit your ability to make good decisions. If you are taking Norco or Ultram, you need to make sure that you have a driver bring you here to your post-op appointment. If you're just taking Celebrex and Tylenol, then you can drive yourself. But if you are taking any kind of control substance, then you cannot drive. It's also important to remember that if you did do your procedure with a local anesthetic and with Ativan, that first 24 hours after you've had that Ativan, that medication is still in your system. And that medication leaves you with a little bit of amnesia. And so you have to be careful about some of the tasks that you normally would do at home. You can't drive within 24 hours from having Ativan. And we also recommend that you don't cook or use any type of machinery or any hot items like a curling iron or something like that, because the Ativan does really affect your memory, and we don't want you making any bad decisions that could harm you. I'm going to talk about common medications for post-procedure. The first one would be your antibiotic. This could be Duracef or Cipro. You took your first dose of antibiotic before your procedure. Your second dose is going to be that evening of your procedure. And the third dose is going to be the following morning. And that's if you've had your procedure with a local anesthetic. If you've had your procedure with a general anesthetic or with IV sedation, you're not going to take your first dose of antibiotic until the evening, and then you'll follow that and take the next morning and then the following evening. The next medications would be your pain medications. These could include Norco, Ultram, which are controlled substances. So these medications you need to take every 4 to 6 hours. Also, along with these medications, you might be given Zofran, which is an anti-nausea medication. This medication, if you tend to get an upset stomach easily, make sure you take your anti-nausea medication, which would be your Zofran, a few minutes before you take your pain medication. It also helps to have some crackers or have some toast or have something in your tummy before you take these pain medications. A couple other things that are important to remember: you have a clonidine patch. That was to help control your blood pressure. This patch stays on for 5 days after your surgery. Another patch that you are going to have on is a scopolamine patch. This is an anti-nausea patch. This one you remove 3 days after your procedure. When you go to remove that patch, make sure that you wash your hands, because that medication stays on your hands, and if you accidentally rub your eyes, you could have blurry vision for up to 24 hours. We talked a little bit about removing the wrap 48 hours after your surgery. I want to be a little more specific about that 48 hours. 48 hours is counted from when your surgery is finished. So if you leave our office at 3 o'clock in the afternoon, that 48 hours is from 3 o'clock in the afternoon of that day of your procedure. Once that 48 hours is complete, you can take that wrap off, and you can have someone to help you do that, and remove the wrap, and then you might have a little gauze or some foam underneath there, and then you're going to get in the shower and you're going to shampoo your hair. It's okay to use regular shampoo, and make sure you clean all the areas. If there's some incisions up here or around your ears, to clean it all up. Shampoo your hair and gently dry it with a cool hair dryer. And then you're going to clean the incisions like we talked about with the hydrogen peroxide in the water, and put a thin layer of bacitracin. Those first few days while we're working on getting the scabs loose, your hair might be a little bit greasy. It's okay to shampoo and wash your hair every day if you need to. Please don't pick any of the scabs. And if you touch things around the house, if you're touching doorknobs or if you're touching anything, a dog or a cat, please wash your hands before you go and clean your incisions again, because you can spread that bacteria from from the animals and from different parts of the house into the areas of where the incisions are, and that can lead to an infection. So it's very important that you clean all those areas. Another tip too, if you do have animals and they sleep in your bed, please clean or put a clean pillowcase or a sheet down on your pillow every day, so you have a clean area while your incisions are healing. Your TED hose are something that we recommend that you have during your procedure. You can wear these up to 14 days. However, we do recommend that you start walking the first day after your procedure. If you're walking normally and not laying around a lot, you can take your TED hose off, but if you tend to lay around, we want you to wear these for up to 14 days. Your TED hose help with the circulation in your lower legs, And just another tip for you to remember, if you happen to fly on an airplane or sitting in the car for a long period of time, throw those TED hose on so they get multi-use out of them. The last point I'd like to make is something for you to watch out in those 48 hours before you come back to see the doctor. If you get a fever 100.4 or above, you need to call the office. Also, which is very uncommon, you can watch for excessive bleeding or swelling. Anytime you have concern, please call the office and our staff will be happy to help you and ease your mind to let you know if there's any problems that you need to be concerned about.